Welcome back. I'm Nurse Educator Chelsea, and today we're going to be talking about anemia. Anemia is a condition in which blood lacks adequate supply of healthy red blood cells or hemoglobin. Symptoms of anemia can include fatigue, weakness, pale skin, chest pain, shortness of breath, tachycardia or arrhythmia, cool extremities, or dizziness or lightheadedness. Risk factors or causes for anemia can include bleeding, frequent phlebotomy, systemic infection, menstruation or pregnancy, decreased red blood cell production, chronic illnesses such as cancer, kidney failure, autoimmune disorder, or alcoholism, intestinal disorders such as Crohn's or celiac, malnutrition, iron deficiency or vitamin B12 deficiency, or being in the ICU more than 7 days. There are several different types of anemia, but I'm only going to be discussing 5 different types today. Iron deficiency anemia is the most common type of anemia and is caused by a shortage of iron supply in the body. Bone marrow needs iron to make hemoglobin. Without iron, it can't produce enough hemoglobin for red blood cells. Iron deficiency anemia commonly results from bleeding, from heavy menstrual cycles, stomach ulcers, or lower GI bleed, as well as cancer, regular use of some over-the-counter pain relievers, or dietary inadequacy or malabsorption. Next is vitamin B12 deficiency anemia. This is a result of inadequate absorption or intake of vitamin B12. Pernicious anemia results as a deficiency in intrinsic factor necessary for intestinal absorption of B12. Gastric disease or surgery can be a cause. The third type is aplastic anemia. This occurs when the body doesn't make enough blood cells as a result of a bone marrow disorder. Causes can include infection, certain medications, autoimmune diseases, or exposure to toxic chemicals. The fourth type is hemolytic anemia. This occurs when the body destroys red blood cells faster than bone marrow can replace them and can be caused by certain blood diseases. One of these blood diseases is our last type and is sickle cell anemia. Sickle cell anemia is an inherited form of hemolytic anemia that is caused by a defective form of hemoglobin that forces red blood cells to be abnormally crescent-shaped. These irregular blood cells die prematurely, causing chronic anemia. Testing for anemia can include doing a CBC or complete blood count or a CAT scan to determine where bleeding might be coming from. More specific tests or blood work might be done if basic testing is inconclusive. Treatment for anemia depends on symptoms. Anemia is generally well tolerated as long as intravascular volume is adequate. Treatment typically depends on the cause and severity of the anemia. If the patient is stable, transfusions aren't usually done unless the hemoglobin is less than 7. If patients are unstable or actively bleeding, transfusions will be given, regardless of hemoglobin, and the source of bleeding will be controlled and addressed. With some patients, hematopoietic medications may be given, and in other situations, when the anemia was caused by a medication, that medication will be stopped. If anemia is caused by malnutrition, we would encourage a diet or supplements high in vitamin B12, iron, or folate. In severe cases, we may give vitamin B12 injections or IV iron infusions. In those with bone marrow disease, we may consider a bone marrow transplant or chemotherapy. Thank you for coming to learn with me today. Please remember to rate, review, and subscribe to get the latest updates on my channel.